This is Andrea. Andrea's been with my practice for about 7 years now, and we've had the opportunity to work on a number of her health concerns. So I'd like to start off, maybe Andrea, you could describe what brought you in at first. You had some back pain. You can describe a little bit about that.
Mainly suffered from low back pain from working in the healthcare field. And so I sought chiropractic help for the low back pain. It's pretty painful low back pain.
Mm-hmm.
Um, I sought chiropractic care just to help. I thought just to help make it go away, but I didn't realize how much benefit I would have long term with it. I was just going for short term benefit. Ended up having long term benefits from chiropractic.
Okay, so you had chiropractic originally, and then you stopped having chiropractic care for some time, and then you started up again here. Okay, so what specifically um, did the chiropractic care that I've provided for you do for you?
The and the initial treatment was for of course pain. I would always re-injure my low back, but I had headaches in addition to low back pain, and I had just kind of dealt with them, but not chiropractically, just on my own with pain relievers or whatever, and was surprised that once we got started working together that I had less and less headaches. As long as I kept my appointments regularly, my headaches stayed away.
And the low back pain resolved for the most part as well?
Yes, my low back pain.
Okay, and that original injury was it a lifting injury?
Yes, lifting patients, working as CNA.
Okay, those can be quite debilitating. Okay, and you've also had some digestive issues that we've had a chance to work on together. Problem with reflux that you sought care through a number of different specialists, and so can you sort of summarize what that how that affected you, and what I was able to do to contribute to that resolving?
Reflux actually got worse after I had kids, but I'd had it off and on before then, and I hadn't really attributed it to anything other than maybe I wasn't eating great. But the primary care physician, is where I went to first for that, and of course they gave me a prescription acid reducing medication. It didn't really resolve the issue completely, and whenever I started seeing you for the chiropractic care, we started discussing that and actually doing adjustments on my abdomen for that, and that's the only time that I actually had resolution with the reflux. Very rarely, if ever, do I have reflux now. As long as I maintain, as long as I keep getting my appointments.
Great. Okay, well that's good to hear. Okay, and you have a rare condition known as Chiari malformation. Can you describe a little bit about what that is and how it affects you?
It is a skeletal deformity where the base of my skull is a little too narrow for the brainstem, and so the brainstem presses on the base of the skull and slowly but surely erodes away bone from the inside just from the pressure. And I didn't realize that I had that until 2 years ago. Went to a neurologist for a consultation with extreme neck discomfort that we really weren't able to pinpoint. And after some MRIs and things, he said I have a very mild form of Chiari, and that I could attribute quite a few of the symptoms that I've had over the years with like ringing in the ears and lack of sensation in the skin on my scalp and things like that, to just pressure in my brain from this just a little bit too small of a skull. But as long as that we were, we maintained the schedule, the routine with chiropractic care, I've kept my headaches at bay. With that.
So headaches are potentially one of the side effects of having the Chiari malformation.
Absolutely.
Okay, and also you had a bout with some pretty serious vertigo for a while and sought a number of different, went to specialists and sought some relief from that. And that can also be tied in with the Chiari malformation.
Yes.
We were able to do some testing and some therapies for you here for that. And can you describe a little bit about how that went?
We did some positional adjustments. We adjusted my neck in one particular side, and we've done a number of tests to see my balance and exercises to help compensate and gain balance back, which I was not aware of. You know, having stood on one foot, I was unsteady versus standing on the other foot, or what have you. But the exercises and the balancing and the adjustment on one side of my neck, when I left, it was better. And it slowly progressed to get better and better as the week went on. By the time I actually had the appointment with the occupational therapist to evaluate it, it was much better.
Great. And recently we worked on uh, um, trying to get you away from taking, you have a long-standing history of taking antidepressants.
Yes.
And you've taken those since you were a teenager. And so we've been able to successfully wean you off of the antidepressants and replace those with support supplements that are going to help to balance your neurotransmitters in your brain. So,
Yes.
in your words, can you describe what the whole process? How did you experience that process here?
The antidepressants that I've been taking since I was a teenager were not helping. When I was a teenager, they leveled me out a bit, but as I progressed through adulthood, I realized that they were not meeting all of my needs, and so I felt anxiety, I felt breakthrough depression, and I felt sleeplessness. I felt like I wanted to sleep too much sometimes, so I felt like it wasn't meeting my needs. So I contacted my primary care physician who was prescribing these medications and told him that I felt like they weren't working and that I wanted to slowly but surely work myself off of them, and seek alternative methods of just helping cope, help my brain. It was not working. So we did, and then Dr. Roseman helped me do the support supplements, and all the struggles that I had before with sleeplessness or too sleepy, anxiety, concentration, agitation, all those things have leveled off, slowly improved over time, and I wouldn't go back to the regular medicine for anything. I feel like this, all the way around, is so much better.
So at this point, you are taking how much of the supplements? Even you're getting to be where you are self-reliant and don't need so much of those. So compared to when you first started on the supplementation, where are you at with that now?
I have 3 different kinds that I take, and I take each one of them every day, but not. I was taking 2 of them a day, 2 of them of each one at each dose, and I'm only taking 1 of them at each dose at the proper interval throughout the day. So I'm taking a few all day long at the prescribed intervals, but it's half as much as I was whenever I was initially starting it a year ago.
So that's a good trend. So ultimately, you could potentially be off of everything and be completely self-reliant.
Yes.
Yeah, which is the whole goal.
That's the goal.
Great. Well, thank you so much. It's great that you came in with low back pain 7 years ago, and we've worked through all these many different aspects of your health, and I've been able to help you with so many things. Thanks
Thank you.
for talking.